Greg.
I've got posters made up.
Okay, can we get the snuffer? Yeah. Snuff. Hi, how are you? John. Thank you very much. Hi, how are you? Hi, how are you? You're the better half, right?
No, the other half.
The other half.
I'm Joan O'Brien. I'm with the Wyoming holiness too.
How are you doing?
It's fine. Get over your way.
George, we can snuff next. We can snuff that.
Years in Wyoming. I want to thank George Marcello for coming here today with his entourage as part of the Canada 500-day walk, carrying the torch of life. As you know, George has been making Canadians aware of organ transplant donations. He's not new to this adventure. He's walked, I think, 3 years in a row now. He did the Toronto to Ottawa walk 3 years ago. Last year he walked across Ontario, and this year he's going to be walking across all parts of Canada. So on behalf of all of you here today, I'd like to thank George for coming and sharing his message with us. And I'm going to ask Rosemary Ear now to come to the microphone and say a few words on behalf of the federal government. Rosemary, as you know, is our MP for our area, and it certainly is a pleasure for her to come here and visit with us today. Rosemary?
Thanks, Ken and George. George and I are going to get to know one another over his crusade through this part. I met with George on Friday in Wallaceburg, and I won't take too much time up because he certainly has a story to tell, and it comes from a recipient, as we have another proud recipient in the crowd as well. I can tell you, though, that on Health Committee, we took up the topic of organ donations. And I thought, well, this is going to be really an easy subject. Who would be against organ donations? Well, let me tell you, I didn't realize it would be such a complicated issue. We are one of the greatest countries. For the 7th year in a row, we've been nominated the best country to live in, but we're the worst in donations. It's hard to believe. 14 out of every million, I believe, is the stats. A survey was done, and 90% of the population is in favor of organ donations, and about 30% have signed their organ donation cards. But I guess the most important part that I will bring forth today with committee is the fact that even though you sign your organ donation card, the family has the last right to overrule that. So that's a real concern that needs to be addressed, because we had one lady, we had several people, but we had one lady present before our committee. Her husband had passed away about 2 years previous. She was still having a terrible time accepting his death because she did not carry out his wishes. He had signed his organ donor card, and at that time she was so stricken with grief, she could not make herself deliver upon his wishes. And she says today that is probably the reason why she is having such great difficulty. So it's so important to educate your family, your friends, doctors as to your wishes. You want to be a volunteer for life. This is the best gift you can give anyone. So I encourage everyone to stop and think how important it is to, at a time when everyone is stricken, to think of someone else that could carry out those wishes for you. I can tell you that when we had people present, the young people, the older people, just so thankful that they've had a second chance in life. So let's get together, stand behind George, give him a word of encouragement, and I know he will continue to do a fantastic job on our behalf. Thanks, George.
On behalf of all the soldier clubs here and the rate players from Wyoming, I'm going to give George a small token of our appreciation right now. George, this is actually a Wyoming pin and a Wyoming spoon, and it's kind of important to us because as our village is going to be amalgamating in 2001, and so this will be a keepsake because there will no longer will be Wyoming. We will be known as Plimpton, Wyoming, and I want you to have this as a token of our respect. Thank you. In 2001, and so this will be a keepsake because there will no longer will be Wyoming. We will be known as Plimpton, Wyoming, and I want you to have this as a token of our respect. Thank you very much, and thank you for that lovely presentation, Marie. And today is day 35 in my 527-day journey, and I just want to thank God once again for having me arrive safely at another press conference. And I want to thank the family that lost a loved one 5 years ago and made that unselfish decision to donate their loved one's organ. And that's why I'm around today, and that's why I'm able to do the things I can do my part here. And I also wanted to take this opportunity to thank Ken for arranging everything here, and for the great reception that I've been giving, a very warm reception. I call this the fuel that I need to get me to the next community, because going through a venture such as this, times can get very challenging and discouraging. So this is the fuel that keeps me going from community to community, and it takes people like Ken and to coordinate and make this possible. And I really want to thank you for making this all possible. And I also want to take the opportunity to talk a little bit more about the benefits of organ donations. Marie pretty well stated everything and said it so well. It is somewhat of a complicated subject in this country for some reason. We have 90% of the people that would be willing and have a desire to donate their organs, and yet we're falling as the shortest country in the world when it comes to donating our organs. So we're trying to see what the problems are, see why this is, and see what we can do to fix it. See if we need to bring more education and awareness, see if we need to change systems, see if we can develop the ways to make this a country as prosperous as the other countries when it comes to organ donations. And I think what we need to do first is look at this as a crisis, because this is what it is. It's a crisis. There's too many good men, women, and children that have passed away needlessly when organs could have been available. And we need Canadians to know that this is a crisis, and we need our governments to know, and we need all the municipalities to know this. And we need to let them also know about the great benefits of organ donations, because you see, it's not just the individual whose life gets saved, it's also the great joy that's brought to that individual's family, and the great joy that's brought to that individual's friends. And if he's a popular person, he can have up to 1,000
friends. So an act that can bring so much joy, not just to one individual's family and friends, but up to 6 individuals' families and friends, that's a lot of people, and that's a lot of joy that this act can have. And, you know, we also need to let Canadians know the great benefits when a family does donate their organs. I've talked to a lot of donor families, and it really does help the grieving process. And it really does help knowing that, you know, their family's loss helped save somebody's life. And there's also a chance and an opportunity to possibly meet the extended family, or knowing that you can write to the extended family, and knowing that, you know, their loved one's life is beating in another person, and they're carrying it on. And you know, these are the things that we need to let every Canadian right across the country know about. We need them to know about this great spirit that has developed a lot more rapidly in other countries, and for reasons or other, we're just not caught up with all the other countries that are doing well. So, knowing Canadians, though, when we're aware that there's a crisis, we usually respond to it. And, you know, I have a lot of faith and a lot of optimism, and so do a lot of other groups and organizations and individuals, that this country will act on this, you know, and it's certainly coming from a municipal level at this point. We've had some great coordination and receptions from all the communities that we've gone through, and we're expecting to get this 491 times. So this is going to be a powerful statement to the whole country, knowing that we have 491 communities right across the country that are taking the initiatives and the needed work to address this problem. And I think that's just going to be a start, because I think we're onto a good thing here, because this enthusiasm is going to be contagious, and we're going to get more people involved in this. And we need to be always on a positive note, you know, and that includes not saying who's not doing enough or not, you know, like, let's just really spread this enthusiasm and let people know the real benefits of organ transplants. Now, one of the other bonuses that I have when I come to communities is that I get to meet fellow recipients that, you know, I can share some stories with, which at this point is hard to kind of share a recipient story with someone that hasn't received an organ. And I had the opportunity to do that with Lisa, who is a resident of Wyoming, and she received a heart transplant in November. And I had a chance to talk to her while we were walking. She helped carry the torch, and you know, she described to me in a very excited way how the community came together for her when she was in a time of need. And you know, she told me that I made her day. Well, I'm here to tell you that you made my day, Lisa, because it's just such a pleasure to meet more recipients that have had a chance to share their excitement, and you know, so with that, I think I'm going to stop talking, and I'm going to bring Lisa up here, because I'm sure that she wants to share a few words to the community.
I didn't expect this when I woke up this morning. I'm very glad George asked me to join in carrying the torch through our hometown. It is an honor to be able to represent Wyoming like that. I know from personal experience how much this community can do for a person, because you all help me. Applause should be to you guys, and to continue doing that, because you see every day the life that it changed. I have 2 children and a husband. I live among you. That's what it's done, and you all know that. What more can be said? So keep doing it, please. It changes lives. Thank you.
We also have another guest here that I've invited to speak, and he has said he would, is Mr. Roger Mayhew, who is president of the local chapter of the liver transplant. And his wife actually received a liver not too. We also have another guest here that I've invited to speak, and he has said he would, is Mr. Roger Mayhew, who is president of the local chapter of the liver transplant. And his wife actually received a liver not too far off. Not too far off. So I have asked Roger, please come up here, Roger, and say a few words for us today.
Thank you very much, Ken, and thank you to George for his goal and his ambition. And many of you know me from the suit I wear today, and I want to share with you some of the positive things about organ transplantation. And many times families feel that there's things that, because if they decide to donate organs at the time of death, that something will be cheated somewhere. And I'm here to very much convince you that it's not the case. When there is organ transplantation, there is very much a serious need to proceed with the organ harvest, and therefore helps make the process even faster in terms of the funeralization and possibly the autopsy that might follow the organ harvest. So I encourage you, and as it did change the life of our family when my wife received her organ transplant in 1996, thanks to the will of God and to the generosity of a family in Winnipeg, my wife is alive today after 15 years of chronic liver disease. She's now leading a very normal and healthy life. We encourage you to talk to your families, encourage you to think about it yourself, but encourage others to pass that gospel on of encouraging organ transplantation. As Ken mentioned, I'm the local president of the Sarnia-Lambton chapter of the Canadian Liver Foundation. Our organization is here to support and to encourage and help understand and do research for liver disease, and also includes organ donation, of course, which is the savior to many people who suffer liver disease. We encourage you to support the programs that help research, and also, of course, in the case and cause that George is strongly encouraging, and that's organ transplantation. Thank you very much to George. Thank you to the Village of Wyoming for hosting George, and keep up the good work.
Thank you very much. At this point, I'm going to invite you all, please stay, and we have some refreshments, and we have some goodies, some veggie trays and some cheese trays, and we'd like you to partake in that with us. And also, George will be able to then mingle. You can ask George any questions you'd like. We have lots and lots of goodies for you, and I'd really like you to enjoy that. I also have here some articles on the step-by-step organization and about George's walk across Canada. There's all kinds of interesting facts and information in here. And these are here on the table. If you'd like to just go ahead and pass them around, read them, put them back, and just share them. I photocopied, there's probably about 15 of these, so if you'd like to learn a little bit more, be my guest, and at the end of the day, you can take them with you. So I'll end this part of the ceremonies off, unless I have any other volunteers from the audience who might like to speak about organ transplant, or if you are a recipient, because we've had lots of great surprises today, and I wouldn't want to spoil any more surprises. Okay, then what I'll do now is turn off this microphone and get some goodies, and we can start mingling and talking to each other. Thank you very much for coming out today.
when we look at organ donation and transplant, I think we have to look as to why there's a need to reform healthcare today. There's a lot of things being done in healthcare today that were not done 5 and 10 years ago. So we need to be able to look at the future and provide the healthcare that people are going to need. And furthermore, I'm quite proud of the Premier's initiative with regards to organ donation. And I know the media tried to make something out of it, that it was somewhat onerous to talk to parents and to family in tragic cases to donate their organs. But I've talked to recipients and donors on both sides of the equation, and most people are very supportive of the initiative of the provincial government in order to make organ donation, to raise the level of awareness of organ donation at a higher level. Again, it's a pleasure to share this day here with some people, and I'm sure other people have got much more interesting story to tell you than I have. Thank you very much.